vest-style immobilization device, more commonly referred to as the KED, is unique in that it should only be used on stable patients. The KED is also contraindicated in patients who require an emergency move due to an immediate safety threat, for example, a car fire, or if a stable patient needs to be moved because they are blocking access to a more critical patient in the vehicle. So, to clarify, the vest-style immobilization device, or KED, should only be used in stable patients who are complaining of head and neck pain and who are in an environment with no immediate safety threats. Why? Because KED application can be a lengthy, involved process, as you are about to see. Your patient should still be inside their vehicle. If your patient has exited the vehicle prior to your arrival, then the KED is no longer appropriate, and a different immobilization technique should be utilized if warranted. Approach your patient from the front of the vehicle, but do not put yourself in the path of the vehicle, and instruct the patient not to move their head. If you approach the patient from the side of the vehicle, they will most likely turn their head in order to see who's addressing them. Inform the patient that someone will be climbing into the back seat and will be placing their hands on the patient's head in order to restrict movement. Perform a patient assessment to determine if using the KED would be appropriate in this situation. The first step in KED application is manual C-spine immobilization. One partner should retrieve the KED while the other assesses pulse, motor, and sensation in all 4 of the patient's extremities. The KED is considered a body splint, so when PMS is assessed and reassessed, it needs to be done on all 4 extremities. We need to move the patient into a neutral inline position. Do this by placing one hand on the front of the patient's chest to keep them from moving too far forward. The other hand should grip under the patient's armpit, and at the same time, you and your partner should lift straight upwards, keeping the spine in line. After, measure and apply a cervical collar to the patient. Ask your patient to do their best to remain seated in this position. If possible, they could place their hands on the steering wheel to assist themselves. Make sure that you have enough room behind the patient for the KED to fit. This can usually be accomplished by lowering the back of the patient's seat. Prepare the KED and position it behind the patient. Make sure that you have a leg strap on both sides. Unfold the KED around the patient's torso and move it upwards so that it is directly under the patient's armpits. Check with the person holding C-spine stabilization if the KED looks centered, since they have a more central view. Begin securing the KED to the patient with the middle torso strap. Take out as much slack as possible before buckling. This will reduce the amount of adjustment that the strap will need after it has been wrapped around the patient. Tighten the strap using the push-pull method in order to minimize any sideways movement of the patient. Repeat this process with the bottom strap. For the top strap, remove the slack and connect the strap, but do not tighten it yet. Now we move on to the legs. Thread the strap under the patient's knee and slide it upwards using a gentle seesawing motion. Remember, the goal is to not move the patient. When applied correctly, the leg strap should run straight down the back of the KED and under the patient's buttocks. The leg strap should then be wrapped around the patient's upper thigh, bordering the groin. The slack should be removed, and it should be connected to the buckle on its own side. There is no need to crisscross the straps. This next part, you and your partner need to perform in unison in order to avoid unnecessary movement of the patient. Use the push-pull method we reviewed earlier to tighten the leg straps at the same time. If the person holding C-spine stabilization has not already incorporated the KED into their grip on the patient's head, quickly check that your patient is still seated in the upright, in-line position that you placed them in earlier. Adjust the patient again if necessary. Pad the existing void between the patient's head and neck and the back of the KED. Be careful not to over-pad, as this can create voids instead of filling them. In unison, secure the patient's head to the KED with the provided straps. The forehead strap should be applied first and secured at a downward angle. The chin strap should be secured by crossing over the forehead strap at an upward angle. Recheck the middle and bottom torso straps to make sure they are snug. Instruct the patient to take a deep breath and hold it until you finish tightening the top torso strap. Finish the KED application by rechecking PMS in all 4 extremities. Remember that manual C-spine stabilization must be maintained until the patient has been extricated and fully immobilized on the longboard or in accordance with local protocols.